Charles, we're ready to go when you are.
Good morning, everyone, and welcome to WEDI's TEFCA conference. First of all, we're talking about TEFCA, and this is the Trusted Exchange Framework and Common Agreement event. In case you were not interested in learning more about the Trusted Exchange, Common Agreement, RICE, QHINs, QTF, whatever, maybe this is not the right conference. But if you really want to know more about TEFCA, stay tuned. We're going to be kicking off this morning with a distinguished speaker, the National Coordinator for Health Information Exchange at ONC. It is my pleasure to introduce Mickey Tripathi, who is in charge of ONC as the National Coordinator. Mickey has extensive experience, and we really appreciate his advice, his leadership, and we really do thank you and Mary Ann for joining us today to learn more about TEFCA and all of the nuances within the TEFCA reach. So with that, thank you again, Mickey, and I turn it over to you.
Okay, great. Thanks so much, Charles, for the kind introduction, and welcome everyone. I'm delighted to be here. I hope no one left after Charles's introduction. Hopefully, everyone, I can imagine there's not just incredible enthusiasm for understanding more about TEFCA and QTFs and QHINs and all of the ins and outs of that. And I'm really delighted to be sharing this with Mary Ann Yeager from the Sequoia Project, who are our partners in this. And Mary Ann and I have also worked together for many years, and we really value the partnership we have with respect to rolling out TEFCA. So I just want to give a little bit of background on what are we trying to accomplish with TEFCA. What are some of the changes that we've put in place since the last version that people may have seen, and then I think I don't know if we're going to go to Q&A then, but Mary Ann will dive into more of the details of what the common agreement is and the process for getting feedback, as well as the QTFs. So on the TEFCA common agreement and the QTFs are out for comment with the stakeholder groups that are being organized by the Sequoia Project, and we're really delighted that we're in this position to be able to do that. The last public release of artifacts from TEFCA was over 2 years ago, in I think it was like the spring of 2019. So that's a long time, and I think since we've come on in January, one of the priorities that we have in HHS and ONC is to get the 21st Century Cures Act implemented. It's been over 4.5 years since the passage of the 21st Century Cures Act in 2016, and that's got the information blocking, information sharing piece, which I'm not going to talk about today, and it has TEFCA, which is a really important piece as well. And both of those need to be implemented, and so we are leaning very heavily, and neither of them work. So we're leaning very heavily into into moving that from the goals and the aspirations of 21st Century Cures Act to actually getting the implementation done, and being able to get the benefit of what that law was designed to do. So it's been over 6 months since since I started, and over that time we along with the Sequoia Project have done a deep reevaluation of the goals and approach, and did a little bit of resetting as we sort of thought about where we were in this, and the importance of getting things out into the market that are going to make a real difference. And so some of the changes for those, and I know some of you may not have been closely tracking where we were in 2019 with the information that was released then. I think it was draft common agreement and QTF. Scott, Mary Ann can correct me if I'm wrong about what exactly was released then. But there were certain artifacts and that contained certain approaches that were in there. And what we've done is we've gone in, reevaluated taken a good hard look at those, made some changes, and now we're pushing this out to the market for our ability to be able to get feedback, and with an eye toward implementation. So what are some of those changes? The first is the publication of an implementation timeline, and one that's going to be relevant to the industry. So in particular, we didn't, the last time that we had the public release of information, there wasn't an explicit timeline put in there. And and I think myself, having been in the private sector for 20 years in health IT before joining the federal government in January, I just fully appreciate the need for industry to have timelines, for the industry to have some understanding of what is the federal government going to be doing in this space, so that all of you can make your decisions about what investments you want to make and what planning you need to do, and whether you want to participate or not, and when you are going to be in a position to decide whether you want to participate or not. Because as we know, and we'll come back to this, TEFCA is not a requirement on anyone, and so so that's an important thing, I think, for the industry to know, is what are the major milestones, what's the timeline, and then allows you to plan accordingly. So as we said, with the release of that timeline, which was about a month and a half ago, we are targeting Q1 of 2022 for the availability of the common agreement and the QTF for network participation. So what that means is that those will be artifacts and networks that want to go through the process, have an interest in becoming a QHIN, will have the opportunity then to apply, essentially, and to go through the process of signing the common agreement, going through the eligibility part with the RCE, signing the common agreement, and then being able to move forward to onboarding. So that's that's the first thing, was publication of an implementation guideline and of an implementation timeline, and as aggressive as we thought we could reasonably be with respect to having that be in as short a time period as possible, recognizing that this is very complex. We need stakeholder input. This has to be something that works for the market. But on the other hand, it will be irrelevant if it takes us 3 more years to to get this out to market. So that's the balance that we wanted to strike here. The second thing that we've done is allowed more flexibility than it was in the original approach to the Sequoia Project, who is our recognized coordinating entity, the RCE, in both policy and operational areas. We recognize that that the importance of allowing that kind of flexibility to be able to address things that are very fast moving in the industry, and that has a lot of variation across a complex environment in the US, that it was really important to be able to provide the RCE with enough with as much flexibility as possible for them to be able to tailor the approach and be able to help to evolve the approach to meet the needs of industry, so that this can be successful. The third thing that we did is to do everything we can to have greater alignment with existing technical, policy, and business models to minimize market disruption and costs as much as possible. So for example, we've done a lot to align everything we're doing with HIPAA to the greatest extent possible, and that means that because one of the things that we didn't want to do, and that was there in previous versions of this, was having sort of separate treatment of data that one might receive through TEFCA, compared with any other data. And as we looked at that, we just didn't think that that was going to be feasible from a practical perspective. And so we've done everything we can to say we're going to align this with HIPAA, so that when an organization receives information or sends information, they have the expectation, which is the expectation that they have in any other way that they exchange information, that once it reaches them, they treat that information according to applicable federal law and applicable state law, with no additional requirements imposed by TEFCA that would require them to segment data in a way that we know is really infeasible from a technical as well as from a workflow perspective in the vast majority, if not all, systems out in the market today. The other thing is that we removed the consent requirement specific to TEFCA. There was an idea that there would be, sort of a consent requirement. Again, we didn't want to have something that was going to impose more on, on organizations than they already do today in the nationwide networks. And so, basing that on HIPAA, and then having, if there are use cases in the future that require consent, like research, for example, we will evolve and, allow those to be specific use cases that have that requirement. And of course, applicable law applies everywhere. But the idea is that we weren't going to impose a separate TEFCA consent on top of all of this, which would add to complexity, especially if you try to do that across the country. The fourth thing is inclusion of a fire roadmap, which will be rolling out later this fall for industry comment. It's not going to be an immediate requirement. We don't believe that that fire is at a level of maturity that it would allow us to to say that we're going to go live next year with pure and only fire-based capabilities. But we also know that it's just around the corner, that it is just at the point of maturity. And certainly some networks like Commonwealth, like Care Equality, have either already implemented certain fire-based capabilities or are just about to. And so we want to be able to give that indication to the industry of what would be the roadmap for being able to add fire-based capabilities to this, again, so that industry can have that expectation and can plan accordingly as as you decide whether or not you want to participate in this, and for those specifically who are thinking of becoming QHINs, knowing that they have that expectation, which is hopefully something that that is an opportunity and something that the industry welcomes, to be able to understand what that glide path to fire will be. Fifth is inclusion of enterprise level security requirements and processes. We just wanted to beef up at that QHIN to QHIN level, processes for providing greater assurance of enterprise level security. That's very common in industry. We want to make sure that we have those kinds of best practices, as a part of Tefco. Sixth is addition of research as a future use case. We think it's really important that we use these, this commodity type of exchange to be able to embrace as many important use cases as possible. And I think if one of the key lessons I think that we've seen through the pandemic that we're still in the middle of is the need for us to be able to have more information informing life sciences and medical science in general in the easiest, cleanest ways possible that leverage all of the investments that we've made in electronic health record systems already, and do that in the most efficient way possible. So that's an important thing that we want to be able to get to. As I said, it's got a little bit different use cases. That's different requirements. You have de-identified data, definition of de-identified data, limited data sets. You have consent where there is a PHI or PII involved. So those are added complexities from a policy perspective that we didn't want to try to introduce in version 1.0 of TEFCA, because it would slow everything down. But we are working very closely with federal partners and others to think about how that can be sort of a fast second tier use case once some of those things are ironed out. And the last thing is, and Marion can certainly get into some of these, is we did leave openness to get more industry feedback on things such as cross QHIN pricing policies, requirements for push transactions, as just something that we want to be able to. There are specific positions, I think, in the common agreement that you'll see, but we're very much open to getting industry feedback on these kinds of things, because these are areas that that the industry has a lot of experience and expertise on, and we don't want to be stumbling into something that might have a lot of unintended consequences, and want to be able to get industry feedback on that. So hopefully that gives you a perspective on some of the changes that that we put in from the last version. Let me just talk a little bit about the goals, and then I'll stop. What are the goals? Because certainly a fair question is that that there's been a lot of progress that I myself was a part of these organizations that have been making a lot of progress in nationwide interoperability. We certainly want to acknowledge that the industry has made tremendous progress and continues to, as we think about the great strides that Care Equality, Commonwealth, eHealth Exchange have made. We see the work that that Chic, now Civitas, is doing, and the HIEs in state and regional areas are also doing as well. So there's been a tremendous amount of progress. However, there are some things that it's more difficult for the industry to self-organize around or to move more rapidly due to the fragmented industry. It makes it really hard for a group of players to be able to get together and get enough collective action, enough collaboration, enough parties at the table that can help move the entire industry. And it also is hard, and again, I've been in the middle of experiencing that. It's hard to overcome competitive barriers and policy fragmentation as well. And so the hope is that the TEFCA can help to cut through some of that. It doesn't mean we can solve all of those things, but we want TEFCA with a little bit of the federal government backing that can help to cut through some of that, to be able to break open some of the barriers that have prevented us from moving forward in those areas, and get a little bit more sort of far-reaching and more embracing kind of nationwide interoperability than we've been able to accomplish so far. So the single goal of TEFCA is to provide a uniform floor of basic interoperability across the entire country. It's a uniform floor of basic interoperability across the entire country. An expectation for a minimum data set to support core interoperability functions and use cases through common legal policy framework and open industry transport format mechanisms. So it's really about that floor and that common expectation that one would have about what kind of payload would you get back in terms of like the US CDI type payload, and that you should have that expectation that you have access to that type of information, assuming you're authorized, with respect to any type of interoperability kind of exchange that you want to do with any party, in the US, regardless of where they are. So it's that floor that we want to be able to establish. So you have that minimum expectation, like a dial tone service for those who remember dial tones, that everyone should have an expectation, regardless of where you are in the country, regardless of where you are in sort of the care continuum, that you have the opportunity to have that kind of basic interoperability. And in doing that, that will create a platform for market provided value-added services on top. So to the extent that there are networks, that there are application providers, there are all sorts of companies that do data aggregation and value-added services on top of that, allowing that to be the platform for them to be able to build those services and then put those out to market, without an expectation that the network is going to try to move up and replace those services. The idea here is that we're focusing on the broad, uniform, availability for that, for that lowest level kind of interoperability that ought to be our expectation, that everyone has access to. So the improvements that we hope to use the TEFCA lever to open up include a number of them. One is uniform legal, technical, and business model for network to network connection. So there are network to network connections today. Certainly, Care Quality I think has done a great job at being able to bring together under that umbrella, under that framework, a number of the networks already. There's still a little bit of friction though, and it doesn't happen easily. And certainly with the HIEs, it hasn't happened. With a lot of the state and regional HIEs, it hasn't happened, quite in the way that that we'd like it to be able to, in terms of getting more and more of that participation, and having a good trajectory on that, and having that be relatively easy and smooth and as seamless as possible. So that's one thing that we're hoping that that TEFCA can help to open up. The other is opening up the aperture to broader use cases that have been slow to be included in the nationwide networks for the reasons that I was describing before, either because you have collective action problems or you have competitive issues that that prevent everyone from moving forward. But what are some of those use cases? Population health, care management, case management, public health, real world evidence, medical science research, eligibility determination, and individual access, importantly, which means bringing more stakeholders to to the grown-up table, as it were, like payers, both commercial and government, public health agencies, CDC and STILT, which is the jurisdictions, and the FDA, research institutions, both private and NIH, and then other federal agencies, SSA, DoD, VA. And we have already have convened a number of meetings with federal partners to begin the work of thinking about the specific use cases that that they're interested in, so that we can get them as engaged as early as possible in TEFCA based exchange, to be able to allow all the federal investments that are being made in health IT to get the most bang for the buck from taxpayer dollars, to use these at scale kinds of capabilities, but also to be an attractor for TEFCA, to make it more valuable to those in the market who want to exchange with federal agencies, to have that be something that attracts them to participation in TEFCA. We also want to have a uniform industry interoperability roadmap, such as content, such as the US CDI, transport and formats such as FHIR. All of these things are moving forward, with different rates of acceleration, rates of growth, across the industry. We're hoping that TEFCA can provide a little bit more uniformity. I mean, in a country as heterogeneous as ours, you're not going to get pure uniformity and everyone moving in lockstep, and that's not the goal here. But it's allowing a little bit more sort of synchronization, so you can have kind of market movement, along sort of a tiered in a tiered sort of way, and that's always sort of moving forward with respect to progress. Because if you have different parts of the market that aren't moving forward as fast enough, that ends up dragging everyone back. And so you want to be able to say, how do we have some kind of mechanism that can move everyone forward in more or less sort of the same roadmap and at more or less the same pace. We certainly want to have broader support for different exchange patterns. We've got directed query, broadcast query, solicited push, unsolicited push. Again, that's part of the feedback that we want to be able to get, but being able to say, how do we support as many of those kinds of use cases as it makes sense to support, recognizing that there are other ways to do that in the market. And this is not to displace those, it's to understand where can having TEFCA enable those, will add value to what already exists out in the market. We want a platform for industry level infrastructure components and shared services. So to the extent that, that there are valuable shared services, again, a number of the nationwide networks already provide some of these. When you think of provider directories, you think about, sort of security brokering services, things like that. Being able to have a platform for that to be able to apply across the industry, and that allows us, the greater ability to have scale and efficiency and a little bit more uniformity in how those work. And then finally, and not least important, I think, is hopefully this can be a forum for industry collaboration on novel use cases, identification and elevation of key policy, technical, business barriers to interoperability going forward. And we've seen that happen over and over again in the nationwide networks, as well as in state and regional HIEs and other collaborations, frankly, that once people get together, start working on some relatively simple use cases, they're able to get some stuff done, and trust starts to build, and they also start to see the opportunity of the next thing. And and we're hoping that TEFCA can help to sort of stimulate that kind of sort of innovative forum through through the RCE and through through other bodies and groups that will form through the TEFCA experience. So hopefully, I know I've talked a lot about sort of a little bit of the resetting that we did and what our goals are. Hopefully that gives you a good perspective on it. I just wanted to point out before I stop here that we still have challenges. And as excited as we are that we're able to now start to move this to the market, that we're going to have in Q1 2022, being able to open it up for network participation, we also recognize there are still some challenges. First off, this is a novel public-private model, and we certainly have questions within the federal government. Are we going to have to fight questions of the delegation of authority from the General Counsel's office, for example, who might look at this and say, we've delegated too much to the RCE. That'll be a conversation to have, but that's a little bit of the public-private balance that we need to be able to work through. And the only way to work through that is by putting something on the table and then having us work through it. So that's certainly something that we'll have to go through. Review and clearance by OMB is another thing, right? I think for those who are familiar with federal processes, that's an important step of the process, and so we need to work our way through that. Then there are some agency-specific policies that we're working with the federal agencies on. For example, for for confidential unclassified information, CUI. Just one example. There are different consent kind of things. As many of you may know, different agencies have different policies they put in place. How do we reconcile all of that with a TEFCA model that we want to work for the industry? It's got to work for the industry. If it doesn't work for the industry, it's not going to work for anyone. So that's a little bit of sort of the day-to-day work that we're doing, and try to identify where there are gaps and try to bridge those gaps. Last thing is, it's still voluntary, and that's that maybe that'll end up being our biggest challenge with all the work that we're doing, is that it's still voluntary, and we need it to be valuable. So that helps focus us on saying, how are we going? What can we do to make sure that it's valuable to the market? Because if it's not, visibly valuable to the market, then we're not going to get participation. So it's got to be valuable to the market. And I know there's often questions that that we get of, oh, is there going to be federal incentives, or is there going to be federal mandates to do it, or could ONC create an exception for the information blocking provisions for those who participate? The number of different levers that people might imagine that that we could use from a federal government perspective. I think one of the challenges is, and I think that everyone's open to sort of thinking about how we might be able to sort of motivate more participation in TEFCA. It's a little bit of a chicken and egg problem, though, which is that we need to have something out there in order for people to to feel like, okay, here's some levers now that we can exercise for something that we have some confidence will actually be successful. Right now, TEFCA is just a bunch of PowerPoints and pieces of paper, and so so that's a little bit of the chicken and egg, that we need to prove a certain degree of success in order to be able to motivate the kinds of conversations that would say what kinds of government and market kinds of carrots and sticks might be applied to be able to get people to feel motivated to participate in TEFCA because they find it valuable. So I apologize if that felt a little bit like a fire hose. As you can tell, I'm very enthusiastic about it, and also I talk a little bit fast, but hopefully that was digestible. And Charles, let me turn it back to you. I don't know if we're going to do Q&A or.
Yeah, we are. And Mickey, first of all, thank you. And not only do we have a lot of people who are interested in TEFCA. I think we more than doubled the number of people that joined us after we began. So welcome everyone. I know we have a few minutes before you need to go to another event. And so therefore, let's open it up for questions. We have some in the queue, starting with flexibility typically means lack of consistency, which is needed for a standard. How are you addressing that as you're stressing additional flexibility?
Sure, and I think I may be wrong, so please correct me if I'm wrong. When I was talking about flexibility for, I was speaking in terms of more flexibility for the RCE, who is the Sequoia project right now. And so that flexibility really allows them to have a little bit more authority and a little bit more control over setting policies and running the operations of it. But that doesn't imply that there's flexibility in approaches. I mean, those are things that we'll work on with the RCE, but I think that what we've seen with the QTS, for example, is to strictly specify, here is the technical framework we're talking about. There isn't a whole lot of optionality around that. And the common agreement would say, this is the common agreement. This is not something that gets negotiated with each party. This is a take it or leave it common agreement that applies to everyone.
Okay, and then the next question has a lot of acronyms, but I know you know them all. Are you familiar with a new law in California called AB 133, which mandates HIE participation using API and other HL7 data types for hospitals, clinics, and SNFs? Is your position that the HIEs like CMT and lanes capitalized are not ready currently to support this law?
No, so I mean, I guess the California law is specific to California, and and I think we're really agnostic, really, with respect to the law. So so if that law has as a part of it that that connection to HIE. It could be that it doesn't matter with respect to the law whether an HIE is connected to TEFCA or not, or whether it's TEFCA enabled, or if something in the future would allow that law to perhaps say that TEFCA connection to TEFCA would count as being able to fulfill the requirements of that law. I think those are all things in the future. There was no specific consideration in the TEFCA rollout about individual state laws, because every state has got a bunch of different laws. As I said, everything that we're doing would always say that applicable law applies regardless of which jurisdiction you're in. TEFCA would not supersede anything related to that.
That's a really good point. Then the next question, Nikki, TEFCA seems almost entirely focused on provider interoperability. How do you see it fitting in with the larger landscape, particularly with the increasing CMS focus on patient access and patient-centric health data systems?
Yeah, well, I've clearly miscommunicated, and I apologize for that, because one of the things that's really important to us is that it not be just about provider interoperability. I will say, as enthusiastic as I am about how much progress has been made in the country in the nationwide networks, and I really and very, very enthusiastic and somewhat proud, having participated in those organizations, of how much has been accomplished. One of my concerns about them is that right now they're really focused on provider-to-provider exchange for treatment purposes. And an explicit goal of TEFCA is to say we need to open that up. It's got to support payer types of use cases, public health types of use cases, and has to bring those other organization stakeholders, like payers, like public health, like patients, to the adult table, as it were, so that they are first-tier customers of TEFCA-enabled exchange.
And the next question is probably coming from a payer. Payers are trying to support TEFCA, but we need money incentives to move hospital SNFs and LTACs to get them to participate. So I think it's just a comment, but certainly one that would give you, I don't know if there's any response aside from no.
No, yeah, I mean, as I said before, again, it is a little bit of chicken and egg. I appreciate the point. It is a little bit of chicken and egg. I will say that, I've often in the past, having working in industry, one of the things that, when we were always trying to get payers to help to subsidize the creation of state or regional HIEs that I was involved in, one of the things that we always heard from payers is, we're not going to pay to drive people up the adoption curve. they need to show that they have adopted, and then maybe we can talk about what kind of value are we getting, and then how do we have the disposition of value so that we're willing to pay for things that are valuable to the business model. And I think that we're in a similar situation here, that you've got a bunch of people, a bunch of stakeholders who want to say, well, I need to see that TEFCA is actually real. I need to see that people are adopting it before I'm in a position to say I'm going to invest money, or I'm going to start to exercise authorities. I'm requiring people to participate in something that that may not even be successful.
And then our last question, because I know that you have to sign off soon, ask about how do we convince people, and asking you for a 2-sentence value statement to convince people TEFCA is a better option for them than direct exchange or other models, especially given the various direct fire exchanges already in the process of being built.
Yeah, so I'm not sure I understand the question by direct. I originally thought that they meant direct with a capital D. But
yeah, you mean in terms of DIR, that.
Yeah, but then they said direct fire, so I wasn't sure if that meant API, type of exchange, like a point-to-point sort of API, kind of exchange. Let me just say that the TEFCA, the idea of TEFCA is that it should complement all those other things that are already going to exist in the market. This is not, the idea here is that this replaces direct-based exchange. Direct has made tremendous progress and serves a very valuable use case and a very valuable function. And so TEFCA will complement that. And we expect that direct-based exchange will continue to exist in the market and, and serve that very particular use case. And the same thing with Fire APIs. Fire APIs, I think of TEFCA as B2B wholesale type exchange. That's commodity back-end exchange that ultimately, hopefully the users, the front-end users aren't even aware of it. In the same way that I'm not aware of, what standards used by my cell phone. I don't know what's, so Charles, I don't know what cell phone you use, and we don't know what the standards are underneath it. We just know that when you activate it, it works fine. It's all sorts of back end. But I do know how apps work on my phone because I chose those apps. Right. So when I choose an app, I have a very specific use case. I've got the APIs, and the underlying infrastructure helps us support that. In this case, that you're going to have that back end expectation that at a B2B level, and with individual access as well, but a lot of the B2B use case, the high volume, high capacity kind of traffic, being able to serve the interoperability needs in the mainstream, but also and somewhat separate, having the ability to have fire-based APIs that can serve others for very specific individual use cases, and then in the future enablement of fire-based exchange, but that doesn't again supersede or preclude the idea that you're going to have fire APIs living in the wild, just like we do in the in the market today.
Mickey, really appreciate your comments, and as always, you're right on, and we look forward to continuing to work with you on certainly TEFCA, but certainly all of the other interoperability and challenges and opportunities that you are providing us with, and making with the patient in mind as we are trying to put everything in the hands of, like you said, with the your apps and your choices and the ability for to make decisions. So with that, thank you again.
Thank you, Charles. Thanks so much for the opportunity, and thanks for everyone's engagement. And I don't know if it's possible to send the questions to to us and to me later. I'd love to. I know there are a lot of questions. We certainly want to be responsive, and happy to respond to those.
Absolutely, we're recording the questions, and we'll send it to our panelists after this event. So because it's nice follow up.
Okay, great. Thanks so much.
Thank you again, Mickey.
All right, bye-bye.
So Mary Ann, I'm hoping that it's going to be a pleasure to welcome you again and to see you again. Thank you again for joining us. Mary Ann started her career at ONC. Maybe something earlier than that, but what I recognize is your work with ONC, and then that led Mary Ann to really focus on interoperability. She's committed her career to interoperability. 20 years on health information technology, serving currently as the CEO for the Sequoia Project, and is a nonprofit solely focused on advancing secure, interoperable nationwide health data sharing in the US. As a steward of health IT interoperability initiatives, and the Sequoia Project's initiative called eHealth Exchange is a nationwide public-private health information network that has more than quadrupled connectivity, connecting more than 75% of all hospitals for federal agencies and supporting 120 million patients, including active duty, retired, and veteran members and their families. So with that, Mary Ann, thank you for joining us. And I know that there's some of the questions that may have been asked of Mickey that you can incorporate, but thank you again for spending the time with us. And I turn the program over to you.
Well, thank you, Charles, and thank you, Michael, for inviting me. So I wish I was so young that my career just started from the time I did work at ONC, but actually I got my start on the healthcare clearinghouse side and was actively involved with WEDI back in the day with HIPAA, and so it's always great to speak with you all. I do want to also note that we spun out the eHealth Exchange as an independent endeavor back in 2018. Same with Care Equality. We incubated Care Equality, which is really the private sector's response to TEFCA. It predated 21st Century Cures. So those are both independently operated entities. So what I'll focus on today is really our role at Sequoia and the capacity of having a designated status as the private sector recognized coordinating entity. And you heard from Mickey in terms of TEFCA. And, really here under the capacity of our work under a cooperative agreement. So anything I'm sharing today is not an official position of ONC or the US government. So you know how those declarations go. So I'll talk a little bit more about TEFCA. I'll talk more specifically about the timeline. Mickey gave broad brush strokes. I want to do a little bit of a drill down into the implementation guide, which is called a technical framework for networks who seek to become designated as qualified health information networks. There is a legal agreement they have to abide by as well. I'll talk a little bit about what we're doing with respect to that, and then feedback opportunities. And, any questions, happy to address today. I really have time allocated to talk with you all. I love getting questions and just want to hear from you all. And if there are any questions that come up afterwards, you can always email rce@sequoiaproject.org. If there's certain questions you want to field to Mickey, we can kind of triage them and send them their way. So just for simplicity, if it's easier for you all, happy to do that. So, when this first came about, Cures was really responding to feedback that they were getting both from the provider community, the health plan community, and others who felt like they had to join multiple networks in order to get the connectivity they wanted and needed. So if you think of a large health plan that's multi-state, they were being asked to join multiple HIEs or multiple health information networks, or a national network and local networks. And same thing with health systems that operated in multiple states, and same for any player that really operated in more than one state. So that's and then even aside from that, there were different sometimes use cases that were similar but slightly different between, say, a national network and local and regional. So the reality was that, they felt, and Care Equality was in its infancy at the time that this law was passed, 21st Century Cures. So I think Care Equality didn't quite have the traction that it does now, where they're exchanging billions with a B of consolidated CDA clinical records for about 90% of the EHR market is represented through that connectivity, connecting networks like eHealth Exchange and Care Equality and Commonwealth. They're all connected on the Care Equality framework. But TEFCA, the government felt that they needed to really have an opportunity to have a government endorsed approach that simplified the manner in which connectivity was facilitated, so that you could have sort of a home network and that'll provide the gateway to the nation. So, and whether that was going to an HIE and connecting to a national network or whatever, that there was an opportunity to sort of simplify that in order to scale. So there was a lot of progress, as Mickey mentioned, on treatment, but then there were other, wasn't really ubiquitous. And then there were other gaps that needed to be addressed. So this was an opportunity to really have a government endorsed approach. So Cures basically directed ONC to convene stakeholders and develop or support a trusted exchange framework and common agreement. So they could point to an existing framework, or they could choose to develop one. And ONC chose to develop a framework because there wasn't one that was fully operational at the time that met their goals. And so that's really the work that we've been undertaking since August of 2019. So the idea here is that benefit would be that there would be a nationwide scale, it would be a way to simplify the connectivity. This is a federally recognized approach, and while voluntary, that there would be enough value and trust in it, and that, you know, having that federal recognition would also be an incentive to participate. So it wasn't, you know, sort of trying to pick one network over the other. You sort of, you know, you could participate and have some connection point into this federal ecosystem, federally sponsored ecosystem. This does account for providing information to consumers, providers, state public health plans, and individuals, of course, you know, as we mentioned, they're consumers. So the benefit would be, you know, make it easier for us to get our own records regardless of the platform we want to use. There would be, you know, a more comprehensive picture of someone's health. It would, you know, certainly have provided much value in response to COVID. So easing the burden of public health reporting, an emergency response, for instance, and then also addressing the needs of health plans to get the information they need for care management and value-based care. And the idea was that there would be one way of exchanging information for these multitude of purposes and multitude of players. So again, a federally endorsed national approach. So this is how it works. So we were selected by the ONC to serve as the private sector organization, the recognized coordinating entity. Our role is one of governance and oversight of the networks who choose to be designated and who meet the criteria to be qualified health information networks. These are sort of super nodes, they're aggregation points, it's a utility model. And the idea is that the TEFCA is really what that box represents, and that is defining the expectation of what these QHINs have to support with each other. It does not specify how QHINs connect to their respective participants and those who connect through them, which are called sub-participants. It's simply specifying how these super nodes interact with each other. And the idea is that it builds upon the capabilities that already exist. So I think there were questions about, well, what about FHIR, you know, based exchange? What about direct messaging that may exist? What about existing HIEs and networks that exist? Well, all that is considered intra-network, or even one or two steps removed from a QHIN. And the assumption is that will continue to operate as it does. Now, to support TEFCA, it may be that those QHINs translate or, you know, do whatever they need to do to support the protocols and the obligations between each other, but that there's sufficient autonomy for them to operate as their networks as they wish. The understanding here is that a QHIN could actually connect a different variety of participants that are connected intra-network, and it could be very diverse. So there's not an assumption of any particular network architecture or how many, you know, how much the hierarchy, you know, how many layers there might be. The idea is that every network may be different. So a QHIN, maybe it's a national network and it connects HIEs and health systems and others. Maybe a QHIN is a multi-state HIE that has desires to be, you know, sort of a national hub. So it doesn't really prescribe, you know, who can be a QHIN. Rather, it's going to be a matter of who can meet the criteria and if it's a strategic fit with what they do. And I'll talk a little bit more about the expectations of QHINs because it's really, you know, quite a high bar, and it's not intended to replicate every network that exists today. So in terms of our role here at Sequoia, so we have been working with ONC to develop the common agreement. We delivered the first draft version of that to ONC last year. This incorporated provisions that ONC wrote. These incorporated additional provisions that we wrote and that we received public input on, and then we delivered that to ONC in August. We've been working with them since then to take it through the ONC policymaking process and review process. We do have a revised version of the common agreement that was delivered to ONC at the end of July, and we'll be iterating on that and enlisting public input on elements of that will ultimately feed into the first version that's put forward for adoption. So that's an example of where we are with that. ONC had already drafted the draft implementation guide or technical framework for QHINs. So we basically applied our expertise. You can imagine that given our experience, and Carey Quality is actually part of the RCE team, because Carey Quality has already operationalized a comparable approach to this, and supports most of the protocols that are being proposed for the QHIN technical framework. And so since they already have an operational framework comparable to TEFCA, that it makes sense that we would apply the expertise from that team as well as public input. We have an obligation, and actually this is our sweet spot of really bringing together different stakeholders and getting feedback. We do this through targeted sessions, public monthly informational calls. We'll do definitely more targeted output as these different deliverables come forward. Once the first version of the QHIN technical framework and the common agreement are put forward for adoption by QHINs, we're expecting in early 2022, that we have a process to identify, designate, assess, and QHINs. And we are the only ones who can actually make that determination. We actually, report that to ONCs, and they'll publish a list of who are designated QHINs. And then we'll have an ongoing obligation to monitor ongoing compliance. So if there are issues related to noncompliance, we're the one that remediate that in conjunction with the defined governance process. And then starting this year, we're working on developing a sustainability strategy. We are just concluding year 2 of the cooperative agreement. We were awarded year 3 of this arrangement. And so that's when we'll start focusing on sustainability, although we've been thinking about it plenty since the beginning. So this is how QHINs are structured. So a QHIN, again, is an entity. It's a health information network that both has the technical capabilities and the ability to meet all of the governance and policy and privacy and security and functionality to connect health information networks or providers or participants at scale. So the idea here is, again, these are highly robust, highly sophisticated, high performance, high security networks. Not every HIN that exists today has the ability to be a QHIN. The idea is to have these as aggregation points and have the ability to have these QHINs interconnect with each other, and by product and by extension, bring forward their participants who connect to those. And even if they have other entities that have an arrangement with the participant to connect, the idea here is that individuals will participate using a platform of their choice, and that they would likely connect to some other organization and ultimately through a QHIN to now allow individuals to get a copy of the information that pertains to them. You see that it doesn't assume any particular hierarchy. It could be maybe there's a QHIN that's designed around individual access services. Maybe there are QHINs that serve as aggregations of large health systems or HIEs that themselves have different connection points. And the idea is that it doesn't, really preclude any number of, any particular hierarchy. So what can you do with TEFCA? Well, there are 2 modes of exchange. There is the ability to query between QHINs and the ability to push information between QHINs. So those are the 2 exchange modalities put forward today. What is being exchanged? What's being exchanged is the consolidated CDA version 2.1. At a minimum, QHINs are required to exchange the US CDI. The purposes for which, and I will say that QHINs have to support all exchange modalities, they have to support the information exchange, and they have to support all exchange purposes, which include treatment, payment, healthcare operations, public health, all of which are defined by HIPAA, individual access services, and benefits determination, which shorthand is the ability for benefits program like the Social Security Administration to be able to get copy of an individual's records for determination purposes. So a QHIN has to support all of those. Now, their participants and sub-participants don't have to provide information for all of those exchange purposes, but a QHIN has to support all. And then to the extent there's information available and they're permitted to release it, and it's in accordance with all the provisions of the agreement in terms of safeguarding and deferring to applicable law, and that they're permitted to release it, and that if there were consents that they were obtained locally, but that's really the minimum expectation. And so the thing that goes above and beyond what exists today in the market is really, today we have fairly pervasive exchange of information for treatment purposes, but it's the other purposes and the other players who participate in payment operations, public health, individual access, and benefits determination that may not be fully represented.
Hey, Marianne? It's
Yeah.
Michael. Hi.
Hi.
Are you sharing slides right now?
Oh dear. Am I not?
No, sorry.
Oh my goodness, Michael. Oh no. Hold on, let me see. Share screen. I'm sorry. I should have seen that. And I'm like so far down my presentation too. I'm so sorry.
Thank you, everyone. I've been trying to get in touch with her, but
Well,
no,
I had
we're
it
good.
minimized and I couldn't see the window. I'm so sorry. And I'm like 11 slides in. Is there anything you want me here? Let me back up a little bit because I want to make sure just I can explain the relationship here. So this is ONC. They've designated us as the RCE. We're the oversight role. The QHINs are the only ones bound by the QHIN Technical Framework and Common Agreement, right? And then they represent a subsequent number of connection points, for if that makes sense. And those are obligations. And then here you can see again, the QHIN can have any number of different approaches in terms of who they connect and how many hops or so to speak. Those are probably the most important. Were there any questions before I move on, since I jumped so far ahead?
No, Marianne, I think it's we're going to be sharing the slides after, but
Okay.
it is I thought it was at one point just me. I said, well, I don't see those, but thank you, Michael, for bringing it to our attention. And please go on. And then what we'll do is, let me just sort of lay the groundwork. We have a great deal of time built into this agenda for questions. And then at the conclusion, we can have the discussion, answer the questions that are in the queue, and I can either read them to you or whatever you feel comfortable with. So I'll let you continue.
No problem whatsoever. And if you all want to type in your questions as we go, I mean, we're used to, at the RCE team addressing questions real time or queuing them up. So just to reiterate, there are two exchange modalities: the query, that's the ability to request and retrieve information, and the ability to push information. And these are the requirements that have to exist and the capabilities and functions that have to exist between QHINs. And again, I mentioned these are the exchange purposes that all QHINs have to support. The idea is that there will be expansion and evolution of what exchange is supported through TEFCA. So for example, there could be additional exchange modalities such as publish, subscribe. So say you want to receive updates regarding a particular person's records. Well, you could say, I want to receive updates to Marianne Yeager's records, and then any changes that come in, receive that. So that's an example. It could be population level data. Instead of right now, we're talking about individual records that are requested or pushed. Mickey mentioned there's a roadmap to support FHIR-based exchange. So FHIR is really geared around point-to-point arrangements, and TEFCA is all around network-to-network. And so there are some elements that are missing today that need to be addressed around security, and OAuth wasn't really designed for that multi-hop where you have a hierarchy of going through multiple connection points. And so Carrier Quality actually has already developed a specification in that regard, and we'll certainly look to that. I mean, we look to work that exists versus starting anew. So that gives you a sense of, and then also exchange purposes. Mickey said, hey, look, we need to contemplate how could this be used to support research. So there's certainly an opportunity to expand over time. So this is an example of what a QHIN might look like if it connects HIEs as participants, and if there are other members of the HIEs who are connected as sub-participants. So it could be that there's a QHIN that connects multiple regional and state HIEs. The HIEs themselves could connect a myriad of different types of parties. There's a lot of diversity among HIEs that exist. Some are very public health focused, some are, really focused on providers, some also bring in health plans, and it really, from a QHIN to QHIN perspective, we're agnostic on that, but there's just a recognition that there's going to be a diversity of the types of QHINs that might exist. So that's one example of how the players might play out. I will say that there is a role for all to play in TEFCA. And so the first thing I would think is, where would your organization fit in terms of how you would connect? Is it possible to connect to an HIE? Is it you're already connected or want to connect to a national network? Is there some other network that you've been working with that might aspire to be a QHIN. And so there are lots of different ways. I will say the expectation is that a public health agency, a health plan, federal agency was not really what one had in mind to serve as a QHIN. These are supposed to be aggregation points. And again, the level of sophistication and bar for what a QHIN has to support is high. This will be part of the critical infrastructure for the US. ONC is consulting the National Security Agency. And, it's just the idea is that these are going to be pretty sophisticated, well-resourced organizations and not necessarily fledgling startups or networks that have never connected before. That's really not what this is intended. That said, there's a role for all to play. Here's another example of a potential QHIN that maybe has a different diversity of participants. Maybe they connect federal agencies or public health providers, plans, HIEs themselves. And so again, it shows you just again, it really doesn't matter what the entry point is, but all things sort of lead up to that QHIN to QHIN exchange, which is expected to be really like really a broker of transactions, a very commodity-based routing of transactions. Don't necessarily assume that a QHIN would hold data or certainly not necessarily be a data repository. So again, it's just sort of having that minimal functionality of having those transmissions between the QHINs. So again, this would be a good opportunity. I see there's some questions coming in. I'll screen them real quick. Can individuals send data as well as receive it? That is not yet contemplated for sending information. Right now, I think it's mainly a request only. Let's see if there are any others who are familiar with the California law, which seems to emulate TEFCA. Let's see, LTPAC, I think we already addressed that. Okay, and the consent model. Yeah, the consent model, I'll just mention to that the QHIN Technical Framework, just to build on what Mickey had said, the QHIN Technical Framework provides a mechanism to convey consent, whether it's in a PDF or some other form. The idea is that consent will be required for individual access services, but otherwise it defers to applicable law. So we really can't, require QHINs, which serve many, many markets, to be the intermediaries of consent unless, perhaps they have a relationship directly with the individual. And I think that's all. There was one, do you envision revenue sharing to work with all QHINs connected to sustainability? Yeah, we will get into the issue of fees relative to whether QHINs can charge each other fees when the common agreement is shared. So right now we did seek input on that specifically, but it wasn't specified quite yet. And there was a question of what is meant by all exchange modalities, meaning that if you're a QHIN, you have to support both query and message delivery. You have to support all. You mentioned that USCDI was the minimum data exchange requirements, but many of those exchange purposes require other types of data outside of clinical. Are there other requirements around those data in those areas? Not yet. I think right now the minimum is the USCDI, but recognizing that will be expanded over time. And then we can just, let's see, our QHINs repositories or federated exchange services, they could be either, but there's not a requirement for a QHIN to be a repository. What should state health departments be doing relative to prepare for TEFCA? I'm going to pause on that one and go through the rest of it, and then we'll address some of those. I just wanted to sort of address some of them real time so you didn't have to wait to get your questions answered. So when is all of this going to happen? So we have been working in earnest with ONC since the summer of 2019. We have the draft QHIN technical framework where it's available for public input as we speak. Input is expected and desired through September 17th. We've had 2 webinars so far, one of which was an overview. It's recorded and on the RCE website at rce./sequoiaproject.org. And there was also another deep dive last week. So again, you'll find recordings of both of those there. And I think there's a third one that's being scheduled. You'll see that maybe it's just those 2. So we do take feedback real time. We take feedback in chat form. We don't necessarily have to have information in formal comment letters. We know that a number of folks don't have the resources to do something like that. And it's really important for us to get feedback organically, like through forums like this. So it's, if we could have a compilation of all the comments, it just helps us, really track the feedback. The common agreement draft version 1 is basically done. It's been accepted by ONC as a draft working version, and there will be a summary that is published. Since most folks are not attorneys, rather than trying to get feedback on contractual language, we're going to boil it down. We've already boiled it down into plain language. We'll be getting feedback on the key tenets of that. There is a work group that was convened last year through an open application process, reconvened that work group. They are working through section by section of the agreement, the prioritized set of issues. And so we will be, as soon as we get approval from ONC to share the summary of the key elements in plain language, we'll share that with you all. Of course, that's their timeline. So that's expected to occur this summer. And then we'll use that feedback to inform the version that is then put forward of the common agreement and the QHIN technical framework for adoption. So starting in Q1 of 22 is when we'll publish those artifacts. We anticipate that organizations will be needing about 90 days to review the agreement and to interpret what it means and prepare. And then we'll have a process to apply to provide assessments, and whether it's documentation review, evidence of certification, or technical testing. And then we will go through the RCE will go through a process of designating them, and then have the ability to really refine these artifacts on an ongoing basis. I will tell you, probably the most important thing that we're going to exercise in all of this is the governance process, because as much as we all have so much work has gone into it, we learn by doing, and there are just so many nuances. So I anticipate that the first batch of organizations that go through the process, that we'll learn and we'll tweak. I mean, there will be a lot of lessons learned from that. So that's the timeline. This isn't just a timeline of what we're aspiring to do, but this is our plan. This is our work plan. So of course, from where we sit, we know the timeframes we can meet. The unknowns, of course, are the steps that ONC has to go through their own clearance. And so we're hoping there won't be delays, but we know how government processes sometimes play out. So as a recap, when we think about what elements are needed to operationalize this, this is an operational endeavor. This is not regulation. This is not theoretical activity. This is an actual contract that QHINs and the RCE have to sign, and we're bound to it. There are accompanying standard operating procedures that further spell out how this is going to work. So for instance, a process that spells out step-by-step of the designation process, the eligibility criteria, how disputes are managed, or additional expectations around security. The QHIN technical framework, which are the functions and technical requirements, the process we go through vetting applicants to determine if they really satisfy the requirements for QHINs. Once they're live, what's not here is a directory of endpoints. So QHINs will actually share technical endpoints. We'll maintain a directory of those. We already have a directory. It's a Firebase directory. And the functions for that and requirements for what a QHIN has to support are in the QHIN technical framework. Once operational, we'll collect metrics. And of course, ongoing, this will be maintained through a governance process. And so we'll talk more about what governance looks like when the common agreement elements are published. So talking about the QHIN technical framework, this document in total was published July 26th. Some folks ask, well, why did you publish the QHIN technical framework and the common agreement separately? They were developed in parallel. They were completed in parallel. And not surprisingly, the technical requirements are a lot easier to get approved through a government process than anything policy related, even though it's just a summary of the contract. The contract's been approved. We're moving forward with that. And with the work group and internally at ONC. So we're just really going through a parallel process right now of, parallel process is concluded, but we're waiting for ONC approval of the common agreement summary. So the QTF does point to some things that will indicate the policy direction itself. The QTF does put forward the specific exchange modalities, workflows, functions that QHINs have to support with each other So query means you're going to look for patient records. Now, do you have records meeting these parameters from Marianne Yeager? And there's a workflow diagram, querying for documents, and then the ability to retrieve documents. Message delivery is simply the ability to push information from one party to the other through QHINs. These are the standards that are specified at this point in time for those two exchange modalities. So you can see there's some security protocols that are widely adopted. For query, the standards being adopted out of the gate, this is an initial set, are based on IHE, integrating the healthcare enterprise. So for query for patients is XCPD, XCA is query for documents, and message delivery is XCDR. So the query functions are widely supported today in many HIEs and national networks, and certainly through carrier quality. So those are pretty well baked. Message delivery was, again, focusing on network to network. So this is capabilities that are largely consistent with what's already in IHE protocols, and nominal changes from what we understand from the community to support it. Typically, the question we are asked is, why didn't you use direct and all that? Well, this assumes that parties are already going to continue to use direct protocols and other protocols intra-network. The only thing that this is requiring is that once it gets to the QHIN and the QHIN communicates to another QHIN, that they translate it, convert it into XCDR, which is designed to be network to network. And of course, I think Mickey mentioned we are seeking feedback on QHIN message delivery. I'll go through some of the considerations around that, and of course, a FHIR roadmap. So this is how it's anticipated to work. So you can see the query or message sources here. So you're either submitting a request or pushing information. It goes to the initiating QHIN, and it goes through the gateway. So the really TEFCA is really the QHIN to QHIN piece. It does not specify how the source or the responder really address it. So really the specifications are really right here between QHINs. It doesn't assume that there are a certain number of exchange points or hops. So it could be any number of those that take place. Oops. And so you can see that, I keep clicking on the wrong thing, trying to minimize this of the window. So you can see that, again, it could be any number of steps removed from the QHIN. It could be 1, 2, or even 3 times step removed from the QHIN itself. There are certain obligations that flow down to those who connect to a QHIN directly, or even sub-participants who connect to a participant who connects to a QHIN. So most of the requirements in the QHIN technical framework apply exclusively to the QHINs. There is a section, however, and this is probably the part that I would say is probably the most salient for the community at large, and those are constraints for participants and sub-participants. So there are some flow down technical requirements around the payload itself, around the content, available demographics, and the data classes and elements in USCDI. Again, that's a starting point. It's a minimum. We've got to raise the bar over time for all the purposes we mentioned. We got to start somewhere. There is an expectation that they have to parse an instance of the access consent policy. So that's specified. There's audit logging, and then security itself between the participants and QHINs. The expectation is that QHINs will, other than those things, have their own architecture, their own mechanisms for how they support certain functions. So for instance, in terms of how they look up patients, the original version of TEFCA was, you have to have a record locator service. Well, the practical reality is there are other means of supporting patient lookup, and rather than having TEFCA specify a particular technology or approach, opened it up to give discretion to the QHINs to do so by looking at patients through record location service, or if it's a QHIN level EMPI, electronic master patient index, or if it's a federated approach itself. So it's, there's, again, diversity we anticipate among QHINs and different approaches, and, and that this supports that. In addition, the QHINs have the ability to determine how they connect to their own participants. You don't have to use the QHIN protocols intra-network. You can use whatever protocols you do today. The idea is that the QHINs overlay that and can translate to, if necessary, maybe the QHINs already support these protocols, the QHIN to QHIN approach. Mickey mentioned that there will be a FHIR roadmap. This will be published in conjunction with the first version of the QTFs. This is something we're already laying out what this looks like. The idea is that we'll identify the elements that are needed to support FHIR in a network-to-network approach compared to what exists today, which is a point-to-point approach. And it will, contemplate, the value of FHIR-based exchange when using certified health IT. There are, you can see the 3 key areas that we have to gap fill. I think the carrier quality specification addresses these, so we'll definitely look to that. So it's mainly because you're looking at a multi-hop model, and FHIR was not really designed for that. So we'll look at the security model, we'll look at how to address OAuth, if the originating user is unknown to the responder, and then how routing those RESTful transactions. So we really want feedback on how we can support FHIR-based exchange in the future in a QHIN to QHIN model. So that's another area of interest. Now, we welcome input really in anything. So there are some topics we know that were probably of high interest, such around the definitions, the scenarios for query and for message delivery, the functionality requirements to support the exchange, and the constraints as flow down obligations. And in addition to that, there was a lot of question about, well, how do we address message delivery? Do we require it of all QHINs out of the gate using the XCDR approach? And while we, work on a roadmap for FHIR, which could support, document level or data level pushes, do we defer message delivery entirely until FHIR is readily available, recognizing we would have to develop the specification? There would probably have to be pilot, have some proof of, that it's ready for prime time, operationally. In our view, for new capabilities, there should be an opportunity for pilot before something is rolled out and required at national level scale. Or do we have it as optional, that QHINs have the option to support XCDR until FHIR is readily available? And so we're really interested in all of those. You'll find a link, and the link is here in the presentation. You could just go to our website, RCE website, and there's a form you can use. We also take emails. We'll take feedback here real time, of course, just really whatever is easier for you all to support. So let's see, I'm going to pause here and see if there's anything in particular on the QHIN technical framework before we move on. Let's see. Oh boy. All right, I'll save these till later. These are intensive. Value statement and comments. We are collecting all comments. I would love to get a copy of these. And all right, we'll just address those as we go through. So the common agreement is, oh boy, I gotta figure out how there we go. All right. Let's make sure, I think I jumped ahead of the common agreement update. So the common agreement draft I mentioned has been updated and submitted to ONC. It was revised from last year from the tenets that that ONC had published, I think in April of 2019. And, we had worked on a draft and got input from the public, the Common Agreement Work Group and ONC. We developed an initial set of standard operating procedures. There are a handful of them that we will highlight when the Common Agreement Summary is published, one of which is the QHIN eligibility criteria. So what are the attributes of who can be a QHIN? And there are things in there around governance and security and all kinds of things in terms of what the characteristics of that look like. It's also, there'll be SOPs around standard operating procedures around governance, conflict of interest, dispute resolution, and security. So those are the initial set, and others. We're definitely looking for stakeholder feedback once the Common Agreement Summary is published. Again, we're waiting for approval from ONC. We are already convened the Common Agreement Work Group. They've had 3 meetings to date. They're under a stringent mutual non-disclosure agreement because they're brought into the inside of our work with ONC. So they really can't divulge what they're working on. That's a set of organizations that aspire to be QHINs and a representative set of participants trying to get, boots on the ground perspective. And then the idea is that we'll assimilate all that feedback and then prepare the Common Agreement version 1 for adoption and work with ONC through that process. So the current opportunities for stakeholder feedback, really right now specifically around the QHIN technical framework, there were 2 webinars to date. You'll see here, both on August 4th, which was an overview, and a deep dive, which was on August 18th. The recordings and slides for those are both available on the website. And then you can submit the feedback, use the feedback form, which basically structures the feedback by section of the QHIN technical framework. You can comment on part or all of it, of course. We are trying to get all feedback in because we have to, sort of disposition and analyze it and all of that. So we're looking for the feedback by September 17th. Of course, we'll take feedback on an ongoing basis because this is a living, breathing document and we're going to learn as we go. So no shortage of opportunities there. We are presenting to the Health IT Advisory Committee on October 13th. We'll address not only the QHIN technical framework, but also the common agreement and plans around, the rollout. We also host regular monthly calls the third Tuesday of each month. You can sign up for webinars and take it really questions if you want to email us at any time at rce@sequoiaproject.org. So again, we try to be as transparent as we possibly can. So with that, I think we can pause and, plenty of questions. I have plenty of time available as you all would like, and turn it back to Michael and Charles.
Thank you again, Mary Ann. And is there how would you prefer in terms of you've seen the chat function and certainly the questions? Is there any that we should tee up at this point that you may have not seen?
So here are a couple. I'll just go through the list if that's okay with you. How would I?
Please
Yeah,
do so.
I'm used to it.
Okay, good. It's all up to you now.
Okay, awesome. All right. If I miss any, just nudge me. All right. How would I, as a patient, manage the sharing of sensitive data of these trusted entities? So the assumption is that an individual will have some platform that they use to access information. And so that would really be controlled at that level. I will tell you, and this will come out with the common agreement, that there will be expectations around individual access services. Look around consent and additional obligations around security and privacy. So, it's definitely, this is an area where existing law is not really kept pace with the changing and evolving ecosystem. And so I would look to that. Now, QHIN to QHIN exchange many QHINs may not even have a relationship with individuals. So it's kind of difficult to really be able to enforce that level of, patient control at the QHIN level, but certainly recognizing that's part of what exists. Okay. How is the consent model different under TEFCA in relation to release of access for authorized providers and patients? It really defers to applicable law. Many of the payer to provider exchanges in both directions are high volume, and those are supposed to happen via FHIR APIs. Correct. And that can exist even in a TEFCA context, that would be intra-network. And then to the extent there's payer to provider exchanges between networks, TEFCA could play a role with that, again, translating in that regard. That may be a good instance where FHIR roadmap could play a role. And sort of, the QHIN would translate and add those additional elements to facilitate network to network. And let's see. I think we addressed that one. Revenue sharing, I think we addressed. That. Our QHINs repository, we already addressed that. Okay, what should state health departments be doing now to prepare for TEFCA? I would say determine which network is going to be your gateway and what are the uses and needs of information you might have beyond your state. And so, we're assuming that a QHIN will facilitate exchange beyond a particular region or state and have a connection point to the rest of the country. So a great example, really, COVID is such a phenomenal example of how this could be facilitative, and what are the opportunities there. I think we do need, we actually did have quite a bit of outreach to states and public health community, and there were some really specific needs. And this is an area rather than, because TEFCA right now is a broad brush, right? It's a broad stroke of all these potential use cases. And, what we heard from state and public health stakeholders was, let's get really concrete. Let's focus on a particular use case, a particular workflow, particular data. And we really want to facilitate additional dialogue around that, so we can demonstrate something super concrete and get momentum. And so, I think that there's more work to do there. The time frame when we had these conversations was during the, everybody was at the epicenter of pandemic response. It wasn't the time to have this conversation, so we tabled it. And so it is something it's on our radar to have further conversation. Who gets priority for getting QHIN qualifications? Federal, followed by state, regional, private entities. Well, nobody gets priority for QHIN at all. Though any organization or network that believes that they can meet this very high bar for facilitating high volume of exchange, we're talking tens of millions of transactions a day, that can meet the high bar for security, processing, and all that, would be, there's no priority given to anybody. I would say that, again, when the eligibility criteria and requirements are presented and shared, that we would imagine that folks would sort of review those and take stock and say, oh, well, that fits with our business model and our capabilities. That's something we can support readily. And there's a funding sustainability model, because that's the other thing, is we're going to be looking at the financial strength and health of an organization and their ability to sustain this endeavor. So it's probably not a great fit for a startup. It's probably not a great, or an organization that's never operated a network before, because we're going to be looking for a track record. It doesn't mean they'd be precluded forever, but this is part of a backbone national infrastructure. And, having that high bar for integrity, security is of paramount importance, not only for just having reliability of the network, but also security. Is in every exchange essentially point to point? Someone sends, someone receives. The distinction seems to be at whether you have to have a large clearinghouse agents in the middle of every exchange. It's kind of like that you can't get from there to here without it. Well, yes and no. I would say, every exchange is point to point, but the idea here is that providers, public health plans, et cetera, individuals will have some connection point into the national ecosystem. And it may be one or two hops before it gets QHIN to QHIN. And so the idea is, whether you have a direct connection to a QHIN or not, the QHIN to QHIN is definitely direct exchange, and there are all these different hops. But the idea is you're not having every provider connect to every provider in the country, which is, what would be the FHIR protocol. There's not an intermediary in a FHIR-based architecture. What is the incentive to become a QHIN? Good question. This is I would say the value of an organization to become a QHIN is that it is an enabling factor for making information that's not readily available today available for purposes beyond treatment, and that there is an obligation that other QHINs have to support those purposes. So there's no incentive and there's no mandate. But there is value in also operating under a government endorsed approach. So Mickey mentioned there's no safe harbor from information blocking, but one would assume that if you're operating under a government endorsed approach, that it's a matter that's consistent with what applicable law anticipates. So we believe that if we're successful, we strike the right balance of, expectations of QHINs, that the value around this whole thing is having more information more readily available for a multitude of purposes and partners. Has TEFCA solved the patient identification dilemma? No, it has not. That is still an issue. We simply provide a mechanism to convey information so that identities can be reconciled. Are entities restricted to access records they can show some type of connection to? Do providers need to show someone as a patient, payers that they have coverage, et cetera? Those rules are, I would say, look to the QHIN technical framework in terms of sometimes the exchange purposes will indicate those types of relationships. And so, and again, it often, I think it typically points to applicable law. And we're back to, are there conflicts of interest that will limit what types of organizations could be QHINs or would require strict firewalls and independence from QHIN operations? So let me think about this. The RCE itself cannot be affiliated with a QHIN or candidate QHIN, and which we're not, and those don't have firewalls there. I'm not aware of any particular relationship that would preclude someone from being a QHIN There is a conflict of interest policy, but it's more around governance. So I'd have to look. I'm not even sure how that's addressed in the common agreement. That would be something good to contemplate, but I don't believe that there are criteria that address conflicts of interest specifically. I will tell you, look very carefully to the QHIN eligibility criteria, because there are other factors in there around foreign actors and other things that you want to pay attention to. Do you believe we need formal principles such as generally acceptable accounting principles or GAP to promote common and uniform end-to-end health information governance and management practices? Source to use is the point of organizational management practices. Source to use point of origination to each ultimate point of access use, including exchange. There are definitely integrity controls, and I don't know that they're GAP principles per se. The technical part of it is definitely in integrity controls and all that are addressed through the technical architecture. Now, governance, we are looking into the attributes of how a QHIN governs their network. This is not a technology play. This is the expectation is that a QHIN is a network and it has network governance, and that there are certain practices around that. There are expectations of financial health and other things. Those are more to come forward when the common agreement summary is published. So just wanted to, at least plant a seed about those notions. This is not a technology. This is not a role just for a technology service provider. That's not what a QHIN is intended to be. Maybe a QHIN is a technology service provider and these other things. Are there any learnings in building the fire directory mentioned? Yes. So Sequoia has operated a fire healthcare directory for several years now. And we have a lot of learnings. I would say we're going to be looking further at potential for the need for a directory of directories. So for instance, if a QHIN has a fire directory, healthcare directory, how do we allow those to interplay? So we have been having conversations with the FAST group, from a Sequoia perspective. Not sure how Tefca overlays with that. We're doing some more due diligence around that. How does a QHIN protect someone from information blocking? They still need to address all the specific requests that come in, don't they? Yes. So I don't know that a QHIN can protect someone from information blocking, because really information blocking is much broader than the functionality and the information potentially that is required under TEFCA, although right now EHI is basically the US CDI. So information blocking, HINs and actors who are subject to information blocking will still have to go through the analysis and due diligence and all the exceptions and all of that. I would say that I would assume that TEFCA would provide a readily available mechanism for individuals and others to get health information. That's hopefully, if we're successful, it becomes ubiquitous and makes it a little easier. We do have a lot of information and resources about information blocking compliance on the Sequoia website, including free webinars and resources as a resource center you can look to around that. Lots of complexities on information blocking that go above and beyond TEFCA. We actually have a work group and 3 subgroups focused on just delving into the nuances of those issues. I can tell you it's super, super detailed. Certainly at a level that goes above and beyond what we're addressing through TEFCA, because these are local issues and decisions, and TEFCA and QHINs maybe 1, 2, 3 steps removed from that. But that said, we see that as an important input, to ONC, and certainly informs our work. I would think of TEFCA is aligned with information blocking. So ONC, since they're involved with both, make sure that whatever is in the common agreement and the QTF is consistent with and doesn't, cross any information blocking concerns. The CMS interoperability final rule entrusts consumers' health plans with being their point of connection for all health data. Does TEFCA align or not with this explicit principle? Well, I would say it does, but public policy also encourages individuals to use whatever platform of their choice to access their information, hence information blocking. So all things point to individuals have the ability to get their health information through whatever platform means they wish, health plan and other technology platforms. And I would say TEFCA aligns with all the above. All right, do you see there being a geographic assignment element of QHIN selection? No. Are you looking to have one QHIN and one QHIN only covering area XYZ? If there are more than one, expectations around entities interact with them? No, absolutely not. I mean, we really can't assign geographies. That, really steps on the line of anti-competitiveness of designating a particular entity to serve a particular region. So if there's more than one, I mean, I would say that that is best left to the market for folks to determine what their entry point is to, whether it's through a HIN to a QHIN or directly to a QHIN. We're really not going to be in position to assign geographies. I mean, that just trips up on so many other things and just really would not be appropriate. Let's see. All right. Can you handle? Let me see. I think that's it. Did I miss any? Please let me know, because I'm doing my best to scroll, but I'm not the best sometimes at navigating this.
Marianne, I don't think you missed any of the questions. The one that we hoped you were going to answer is, have you come up with a patient ID solution?
Oh, I wish I could say yes, but no.
But we're hoping that will be done by next week, if you don't mind.
Yeah, I would love that, But the thing is, I mean, here's the thing. TEFCA, let's take the network to network exchange out of the equation. Everything that we do at Sequoia, whether it's TEFCA RC related or not, informs our work. We have the ability to look to approaches around identity, around security verification, around whatever it is, content verification, semantic interoperability, you name it. We have the ability to come up with a market-driven approach that we could adopt through this government framework. And we could point to other things. Sequoia doesn't have to operationalize everything. So the question is, are there opportunities here that are untapped? Now, please, if there are vendors out there, do not approach me about your solution, because we're not going to pick one. But one of the things that is, and I think it's pointed to in the QTF, is could we at least better identify identity trace or patient matching? Could we point to other third-party sources where patient identity can be, reconciled? I mean, so there's certainly opportunity for that. But boy, Charles, I wish, but no, I don't think so, my friend.
Yeah, I think that while there's a lot of solutions out there, I think we all want to snap our finger and hope that some of the ID issues are going to be resolved. But I just think it's an interesting part of the questions here. Thank you, whoever asked that question. And then, I just want to make a plug for any other questions for Marianne, and make sure that we're teasing out the issues that you wanted, because there's a lot of details that Marianne has covered today. You would think that we had come up with all of the other solutions, especially the way that we're talking in with lots of acronyms. But I just want to point to certainly the TEFCA continuation of this series that occurs on August 31st, and it's the stakeholder panel, and we're showing the list of speakers. It's going to be a really interesting further discussion, and we certainly want to make sure that you continue to join us for these. And let me just check to see if there are any other. Well, yeah, as a reminder that Michael's put in the chat function. It's free to the industry. Please sign up at wedi.org. Again, it would be continuing to really discuss much of what we have covered today, but in terms of how the stakeholders are going to be responding. With that, I turn to Marianne again and say thank you for the time today. We are indeed indebted to the Sequoia Project, to your leadership, and certainly to, I still think you should take me up on the offer of, you joined at the beginning of your ONC career. I wish I had that compliment. So in any event, thank you again. And we will follow up with all the questions that were asked today. So, and then Marianne, we will share your slides. And I think you referred to several links that people could go to. So with that, I wanted to thank you. Michael, is there anything else before we conclude?
No, sir. We'll see everyone next week, August 31st, for the Stakeholders Panel, part 2 of our TEFCA series.
Thank you all for joining us, and have a pleasant and safe day. Thanks. Bye-bye.